WLFI and our community partners are keeping an eye on kids in 2013. Every month, we'll bring you stories and interviews on a variety of topics to raise awareness of issues affecting children. It's designed to help parents, grandparents, and others be positive influences on a child's life. Now, the goal is to bring up kids who are happy and well-adjusted with the hope of giving them a good start in life. This month, we're focusing on topics including nutrition. Renee Tilt is a registered dietitian at Franciscan St. Health, and she's developed a program to teach families healthy eating habits. Welcome, Renee. Thanks so much for being here this morning.
Well, thank you very much for having me.
Sure. Well, first, let's talk a little bit about the obesity and epidemic going on in the country right now. And we were just talking off camera. It starts at such an early age.
It really does.
Those risk factors that can develop. Talk a little bit about the recent statistics.
Well, recent studies and statistics are showing that about 17% of our kids aged 2 to 18 years of age are obese, which is up from an astonishing amount from just a few decades ago. About in 1980, it was about 6%, and it's up to about 17 of children that are obese. And when you talk about kids that are obese and overweight and considered overweight, it's about a third of our kids.
Wow, and that can lead to health issues later in life, and some of them may be quite obvious, but talk a little bit about the consequences, of developing obesity as a child and those health issues that happen later in life.
Well, what we are seeing is the development of high blood pressure and high cholesterol in kids, which are risk factors for later developing heart disease or cardiovascular disease. And then also, we're also seeing increased insulin resistance, and even kids are now developing type 2 diabetes. Also, some other consequences that aren't thought about are the social consequences of being overweight. And we really need to be sensitive with these kids that are overweight, because they are suffering from low self-esteem and social stigmas at school.
Yeah, well, you've developed a program. It's a 5-week program, and this is a great way to help parents kind of jumpstart the healthy lifestyle for young kids. Tell us a little bit about that.
Yeah, we're really excited to start this program starting in February. It's going to be a 5-week series, like you said, and it's going to focus on 3 components, which are really important to focus on when you're dealing with kids that are overweight, and to teach healthy lifestyles. Those are going to be, so it's going to focus on nutrition, of course, physical activity, and then also behavior change. Because it's really easy to say this is what you should do, but actually doing it is a totally different realm. You really have to really teach these families, and it's going to be a small, intimate setting where there'll be 10 families together that will be able to interact with each other and decide and talk about, in their particular life, what's going to help them to change behavior in their families.
So how can we sign up, or how do families get more information?
So what they would do is, it's at the Franciscan Healthy Living Center, and they will call a phone number to register. The phone number for that is 765-502-4219, and there will be links on our St. Elizabeth website to get more information about how to sign up for that.
Well, great. Well, good luck with the program.
Well, thank you.
Like great advice there. Thanks again for coming in this morning. We appreciate it.
Thank you for having me.
All right, thank you. Well, you can find much more on this and other topics on our website. You can go to WLFI.com, click on the Community tab, then Eye on Kids in the drop-down menu.
WLFI's Eye on Kids is presented by Alcoa, Wabash National, Nanshan, and Franciscan St. Elizabeth Health.